Hi, I'm Caroline. I'm a trained doula with Birth Prep Doulas. In this video, I'd like to share with you my knowledge about the process of a planned cesarean section so that you know what to expect if this is what your birth plan ends up looking like. So the first thing that you're going to have is you're going to have consent. You're going to have your provider discuss with you what a cesarean section is, the process, the benefits, the risks, and make sure that you understand and consent verbally and also sign that you agree to this procedure and that you have been educated about it. Then the next thing, as you get closer to the actual day that you're going to have this procedure done, is you're going to have some lab work collected and some physical exams just so they have a baseline for you. The day before you have your procedure done, you're going to be asked to refrain from food and drink for 12 hours because this is actually major surgery, and so there's a risk for aspiration, and you want to make sure that your system is clear. So on the day that you get there, you're going to get into a hospital gown, and then they're going to do a simple basic physical exam, just your baseline vital signs, and just confirm your medical history, confirm that you are who you are. And then you'll have an IV started, and this IV is going to be used to administer any fluids or any medications that you're going to need during this procedure. And then the nurse is going to shave your abdomen all the way down to your pubic hair. You may get an enema. You are going to receive a urinary catheter. And then after that, you are ready for the actual process. So the actual process is where you get transferred to the operating room. You get into the operating room, they lay you on the operating table, and you're going to receive your anesthetic. You may be put completely under, or you may get an epidural. This is something that you're going to discuss with your provider so that you understand and you're part of the process of deciding that. Especially because it's a planned C-section, these are questions to ask and discuss. So you have some power in the whole process and some participation in the process. Anyway, so let's continue with the process. You receive your anesthetic, and then they're going to set up drips between your torso, your upper torso, and your abdomen. And what that does is that it separates you from the surgical team because they need a sterile field so that there's no contamination. Depending on your surgeon, your arms may be secured just so you don't accidentally reach over. And the process is going to start. So you may feel some pulling or some pressure as the doctor makes an incision above the pubic hairline. Most of them are across, but sometimes it's done vertically. But this is only, most of the time it's during an emergency. They make that incision, and then they're going to make an incision on your uterus. So now the abdomen is opened up and the uterus is exposed, and then they make another incision in the uterus. And then, so now your amniotic sac is exposed, it is broken, and the amniotic fluid is suctioned. Once the amniotic fluid is suctioned, the baby is removed, and they take the baby and they clean their head and nose and make sure the baby gets to breathing as soon as possible and that the baby is doing well, viable and healthy. And then depending on your birth plan, you might have your baby handed to you so you can have your skin-to-skin bonding with them right away. So that's another thing that you can discuss with your doctor and set up for that. And then while you are bonding with your beautiful baby, your abdomen is being repaired. So first they suture the uterus with dissolvable suture so that they don't have to go back in there to remove them. And then they repair the abdominal incision. And then after that, you and your baby are going to be observed just to make sure that you are stabilizing well. And then once they're sure that you are stable, you will be transferred into your room. And so for planned C-section, plan for about 3 to 5 day hospital stay, and plan to pack a few comforts from home, something that will be a nice pick-me-up for you while you are at the hospital. You know, a nice smelling lotion, a new pair of soft fuzzy socks, you know, a magazine that you like to flip through, photos. Just there's lots and lots of ideas. But that is the process that you would go through if you were having a planned C-section. I hope that was good information for you. I would like to discuss this topic with you more if you're interested, so let me know. And thank you for your time and have a great day. Bye.